Good evening, everybody, and thanks for joining us tonight on this webcast here. My name is Dr. Louis Maltzmacher, and boy, it's a real pleasure to be here with you, and I really want to thank Cy Brian Kerr for sort of being part of this and really and sponsoring these webcasts. I think it's a great service. I'm taking a look at the students that are on here from all over the world, literally. So it's really a pleasure to be with all of you folks. And I know this is a really hot topic here, total facial aesthetics, and I think we're going to go to places where we've never gone before. So let me do a quick introduction to myself. My name is Dr. Louis Maltzmacher, and I am a general and cosmetic dentist in Cleveland, Ohio. That's not a fancy New York or Los Angeles office. That's Cleveland, Ohio. That's middle of the Midwest. So let's get into this here a little bit as we go through this. Let's talk about veneers, because when you talk about aesthetics, we're going to talk about the mic. We're going to talk about the mouth. That's where we're going to start, because that's what we're most familiar with in terms of teeth aesthetics and even soft tissue aesthetics. But when we say soft tissue aesthetics, we certainly are going to refer to gingiva. I'm going to talk about a whole different area of soft tissue aesthetics as it fits into everything else that we're doing in just a little while here. So let's take a look at this. Veneer preparation. Certainly, where veneers have gone in the past 5 years for sure, even maybe a little bit longer at this point, is the whole no prep or minimal prep realm. And full prep, all this is good. It really doesn't matter. It make a difference what your opinion is. But we've certainly found that dentists and certainly patients, the consumer, when they go ahead and they are looking for aesthetics, boy, they would love to have minimally invasive if they have the option. And certainly, there's been a boom of this. A few years ago when there was only one major laboratory that was talking about no prep, and everyone else was saying it was no good. Now it's a few years later, and everybody's doing no prep. It's hard to find a laboratory that doesn't offer some kind of a no prep or minimal prep technique in terms of that. But we know the patient response for sure. And really, when you think about it, the original veneers, when they came out 30 years ago, were really no prep, or they were minimal prep. They were feldspathic veneers, different than what we have today. And they were no prep veneers. Then a few different porcelains have come out, particularly pressed porcelains. You had to make them a little bit thicker, and what the laboratories would tell us to do to compensate would be to prep teeth. So, that's really not the way to look at dental materials when you think about it. Dental materials are really there to serve the patient. They're really not there where you've got to change the patient in order to match the dental material. That's really the wrong way that we've always been taught to look at dental materials. They should be serving patients for there. So there are materials out there for the no prep and to do it well. So let's go through this a little bit, and you'll soon see where we're headed with this entire thing. There are certainly reasons to prep teeth. There are certainly times I've got to get aggressive for prepping teeth for veneers. And again, I'm going to start with veneers, and I'm pretty quickly going to broaden out to the rest of the face. But the concepts, the reason I start like this is because you'll see the concepts that we have in no and minimal prep veneers, and certainly in all kinds of aesthetic dentistry, will be perfect in terms of what we have to go ahead and do, and in total facial aesthetics, and those exact same concepts are then going to compensate over to full facial aesthetics, as you'll soon see. No little invasive, maximally invasive. That's exactly where we're going to go when we talk about all these other things. There are reasons to prep teeth. I mean, and you see a list of reasons there. Prominent teeth, discolored teeth, arch contour isn't that great, misaligned teeth. Primarily, the reason that most people prep teeth for veneers is the bottom one. The lab uses the wrong porcelain. When you're doing a no prep or minimal prep technique for veneers, you've got to use the right porcelain. It's a specialized technique and thereby requires a specialized porcelain. Most dental laboratories, and I use a number of dental laboratories, I love them all, but most dental laboratories are not going ahead and going to use a specialized porcelain for this technique. The reason being is because it costs money to invest in a certain kind of porcelain. They want to use their standard crown and bridge porcelain. Well, you know what? Most of their standard crown and bridge porcelain cannot be made thin. It can only be made thick. And what they tell you to do to compensate is go ahead and prep the patient. But again, that is the backwards way of looking at dental materials. They should be there to serve the patient, certainly when there are materials that are made specifically for this technique. What are the reasons not to prepare teeth for veneers? And again, these same concepts we're going to transfer over into the total facial aesthetic realm, as you'll soon see. The reasons not to prep for veneers is, number one, patient acceptance. They love it. You know, I treat a lot of dentists by virtue of what I do. I talk to probably about 10,000 dental professionals a year face to face, and by virtue of what I do, I speak to a lot of dental professionals. And I guess I end up treating some of these dental professionals there as well. When they come to me for veneers, what do you think they want? Do you think they want prep or no prep? You know, you're dentist on this phone call. You don't want your own teeth ground down. Well, neither do your patients. So from patient acceptance, it's huge, no prep. The whole minimally invasive realm of dentistry is just used. Ease and comfort for the patient, because I don't have to get them numb. And there's no temporaries, as you know that. I love the fact there's no temporaries with no or minimal prep veneers. Why is that? Because the hardest temporary to make in dentistry is what? You know, these 3/4 crown / veneer temporaries. They're hard. And how do you keep them on? Well, you can either go ahead and bond them on. If you bond them on, you have trouble getting them off. And sometimes you even take a piece of tooth off. If you don't bond them on, then a lot of times they just fall off. The most miserable 2 weeks that you spend with a patient generally are when they are in these 3/4 crown / veneer temporaries. I hate them. And so, you know, for me, I would say when I do veneers, 85% of my veneers are no to minimal prep veneers. I mean, literally that high. Because if I'm already going to prep, let's say 2/3 or 3/4 of the tooth for a veneer, quote unquote, I might as well just go ahead and prep the entire tooth for veneer. I mean, what in the world is conservative about leaving a little thin piece of porcelain on the lingual of a tooth? That doesn't really make much sense. So from that aspect, what we go ahead and do is, I mean, what I'll do in that case is I'll do a full ceramic crown. It'll match my veneers. That would be great. But you need a special porcelain for this specialized technique of no and minimal prep veneers. So let me ask this crowd here, because we've got a sold-out crowd here on this webcast here. I'm going to put a poll up here. If you've ever gone ahead and tried no prep or minimal prep veneers, because you'll see where I'm going to go with this in just a second. I'm going to poll all of you if you would go ahead and take, I'm going to give you about 15 seconds to go ahead. And have you ever tried no prep veneers? And yes, no, or have you thought about it? Which would pretty much be a no, but you've thought about it. And boy, and I'll report you the findings. They're coming in pretty quick and pretty strong here in terms of you. I mean, it just goes it exactly goes to what I'm talking about here. They've been popular. I mean, they've been popular. I mean, right now you're polling at about 50% of you have gone ahead and tried no prep veneers. I mean, that is up tremendously from a few years ago. Can you imagine that? I mean, there's another, it's almost 50-50 in this group that we are polling right now. And that's phenomenal. But there's still a lot of potential. A lot of you, and most of you who have answered no, have really answered, they're going to think about it. 34% have answered thought about it, and the rest of you have answered no. That's pretty good. There's a lot of potential out there. And let's talk now about the reasons why you haven't really liked this. We're going to go ahead and end this poll because I'm going to put up a couple other ones as we go through this here. There's a reason that a lot of you haven't tried it. And even those of you who have tried it have been a little bit frustrated, haven't you? The two biggest complaints, and I've been teaching no prep veneers now for literally about 25 years because it's one of the few things that I've done my entire career that's been almost the same, and that's no prep veneers. And the two biggest reasons that dentists don't like them, or even if they do them, that they have trouble with them, is they look too bulky and they're too opaque. So they look and they feel too bulky and they're too opaque. And that's been a pretty big issue with a lot of people. Now, what's funny about the too opaque part is patients have liked the look. And they may not have loved the look, but they've liked the look. You know, going from where they've been to go ahead to nice white teeth is pretty dramatic. But dentists like a little deeper aesthetics for that, and so do patients. I'm going to show you a little bit later on in this. I'm going to show you a little bit later on in this program. You know, a patient that wanted to have their veneers changed over because they didn't look as lifelike as they could have. And that's something that we all have to work together. It's not primarily the dentist. It's not primarily the lab. Well, if it's not the dentist or the lab, then who the heck is it? It's really both. It's really both. You need a very talented lab, and you need a talented dentist or a trained dentist to go ahead and learn how to pick the right cases for this. So let's follow this along for this. But I want you to focus on the bottom one here again. Well, you know what? Let's go. Since we just did that one poll, I'm going to throw one more poll at you because that's going to go ahead and go directly to what I'm talking about. Let's conduct one more poll with you because, again, 50% of you have done no prep veneers. And the rest of you can join in here too. And here's the poll. I'm going to poll you now. The question I'm going to ask you is, were you as the dentist satisfied with the aesthetics of the no minimal prep veneers that you placed? So we'll give you a few minutes, or I shouldn't say a few minutes. We don't have that much time. We'll give you a few seconds to go ahead and do this. But even those of you who have not placed these, go ahead and chime in if you've liked the aesthetics of what you've seen in the cases and a lot of the journals when it comes to no prep veneers. So we'll open this up to just about everybody here. And I think you may be a little surprised at this. I'm not surprised because when I talk to dentists, I poll my audiences all the time for this. But let me tell you how this poll is coming out. Pretty interesting. 30%, it's running around 31% are saying that they have been happy with the aesthetics of a no prep case. 42% means they're somewhat happy with the aesthetics. 28% actually, and now it's even with the yes. The yeses and the nos are exactly the same. The yeses and the nos now are exactly the same. You've got yes on right now it's 27%. I'm going to end this poll here. So thank you for participating. 27% have said that they like the aesthetics. 27% have said they don't like the aesthetics, and 45% have said they kind of liked it. They didn't love it, but they kind of liked it. They somewhat liked it. Well, wouldn't you like most of them to be in the yes category? And here's been the big conundrum when it comes to no prep and minimal prep veneers. The big conundrum has been, we're giving this to our patients. We don't really like the result, or only 30% of you really like the result. The rest of you are kind of iffy, and some of you are 30% of you are outright no. And the rest of you are like, you know, these don't look that great. This is another reason a lot of dentists have not gotten into this whole thing, because we like to feel good about the aesthetics that we are offering our patients as well. So this has been a little bit of a drawback into what we've been doing. So let me show you where it's gone, because it's really gone to another level, and hopefully it'll pull a lot of you people back in here. Here's been the biggest no preparation veneers, the veneer laboratories that have gone in the last few years. And the truth of the matter is there are only a couple. The top two are really the only two laboratories that have been using a specialized porcelain for a specialized veneer. I could list another 150 laboratories here, by the way. But most of the laboratories are just using regular porcelains that they use in other areas and other situations, not specifically developed for no prep veneers. So here you've got two. One is Lumineers, very well known, and they're responsible for, they get a lot of the credit for making this very popular among patients. But now you've got a laboratory called Aurum Ceramics, which has taken this into a whole new stratosphere with their crystal veneers. Now been out for a couple of years, and crystal veneer porcelain, just like Lumineer porcelain, these have been made specifically for the no and minimal prep technique, which means you can make these porcelains as thin as 0.3 millimeters. But Aurum Ceramics is a very interesting laboratory. They're probably the best laboratory that you've never heard of. And what I mean by that is this: unless you've been to LVI, and LVI, you know, and for some reason LVI seems to bring out the passions of a lot of dentists all over the world. People love them, they hate them, they love neuromuscular, they don't like neuromuscular. I don't know why we get into these silly camps anyway, because the whole thing to me is kind of silly. We can take the best out of everybody, and then you're the practitioner, you do what you want going forward here. But Orm Ceramics, but we all agree that one thing with LVI, right? They have absolutely, they deliver top-notch dental aesthetics. There's no question about that. Everybody agrees. We all like our veneers to look like LVI veneers. They do a fantastic job. Well, there are two laboratories that get them there. Only two, and Orm Ceramics is one of them, and Orm Ceramics has come out with their crystal veneers, and this has really been groundbreaking. And what's been groundbreaking about these crystal veneers is they're not too opaque, they're not too bulky. You now have a highly aesthetic lab, okay, that is known for their aesthetics around the world. Actually, they are an international laboratory. They are known for their aesthetics around the world, now come into this no and minimal prep space, and they're delivering aesthetics that are as beautiful as just about anything else that's out there, with a no prep and minimal prep technique. This will satisfy, I would say, 99% of you in terms of the aesthetics. The dentists, again, the patients have liked it. Sometimes they haven't loved the aesthetics, but they've liked it enough because it's such a change of what they have. But I like to feel good about what I put into the mouth. So Orm Ceramics, you can see there's their contact information there as well. Again, if you've been to LVI, and there are a number of you that have been, you know these people. And now they've created these crystal veneers at a very competitive price. And, you know, as veneers have become more popular, the cost of the laboratory has gone up, up, and up. Every dentist listening in here knows that. They're coming in at a very competitive price and bringing aesthetics that are almost unmatched by any other no and minimal prep lab in the world. And it's really incredible. We'll show you some examples here. Let's get clinical here. And I always use this case. This is an interesting case. And again, I'm going to start off teeth-centric for those of you who've come in a little bit late. We're going to get the total facial aesthetics pretty quickly, but I want to start off in an area that you're comfortable with, and you'll see how the whole thing will quickly fit together here. So here's a patient that came to me. He actually is a dentist, and he comes to me, and he's got an interesting story in that the year 2000, he wanted to do more veneers. So what he went ahead and did was he got his own veneers, typically what dentists think from the smile teeth, from tooth number 6 to tooth number 11. And what did he do? I mean, he got some veneers here. And, you know, if you remember back in the year 2000, people were normal then. We didn't do these crazy white shades that we do these days. So he went ahead and got shade A2 veneers. Not bad. And what happened to his aesthetic practice, his veneer part of his practice? It boomed. Why did it boom? It boomed because he went ahead and, he went ahead and would show people his veneers. They'd say, oh, doc, those are great. Let's go ahead. I'm going to go ahead and get my veneers at your office. But what happened is, in the year 2005, there was a TV show that you may have heard of called Extreme Makeovers that literally changed your practice the day it came out. Because in a 1-hour program, 30 seconds, by the way, of which was dedicated to dentistry, people were getting these white teeth that never existed before. And overnight, your practice changed. And all of a sudden, people wanted these white teeth. And you can debate all day if they're natural, not natural, but they wanted these white-looking teeth. And all of a sudden, your practice went ahead and changed, because that's what they want these days. And then the whole minimally invasive thing kicked in. So he comes to my office, and because what happened to his practice? Because now his veneers look dark. These shade A2 veneers look dark. Patients are turning down treatment because they're looking at his veneers, and when he walks out of the room, they'd say to his assistant, you know, if my veneers are going to come out that yellow, I'm going somewhere else. So he comes to me. He also wants to broaden his smile. Now listen to the line I'm going to use, because I'm going to tell you right now that it's not true, and I'll show to you. I'll prove it to you in just a little bit. We always would teach, just about any dental aesthetic lecturer would teach for years, and you'll almost all say it with me, that you know what, if you do 4 teeth, 6 teeth, if you do veneers on 4 or 6 teeth, you're giving patients great looking teeth. But if you do 8 to 10 teeth, or even upper arch and lower arch, then you're giving them a great looking smile. Just remember that line. I'm telling you right now it's not true, and I'm going to prove it to you in just a little bit. But he wanted to broaden out his smile. So now he wants, and you can see right next to them, right next to each other, I've removed the veneers that he's had on number 6 through 11. He also wants veneers now on the bicuspids here. So right next to each other, and you can see little scratches on that bicuspid if you get close to your monitor there. And they're very minimally prepped veneers. Now, think about this with me. The veneers on the bicuspids are only going to be about 0.3 millimeters thick. The other ones are going to be your standard 2.5 millimeters thick. And I really should say those other ones will be 0.3 millimeters thin, because that's how thin they are. The others are going to be thick. Now, this takes a very talented laboratory to go ahead and do this. Because what I want to happen as an aesthetic dentist is I would love to be able to use only one shade of cement to go ahead and cement these veneers. And that's what these people at Orem Ceramics are able to do. They really know their veneers and the opacities and the porcelains that they're using. They're a highly aesthetic lab. Coming from many other laboratories, I would have to fool around with different shades of cement and then try to match it, because the different opacities of porcelain would be technically pretty difficult to go ahead and match sometimes. But not here. Now take a look at the transition. I'll show you the next slide. And all of a sudden, here you go. That big cuspid in front of you, that was one of the prep teeth. And right next to it is one of the minimal prep teeth. And you can see with these veneers, all that light that you see reflecting off tells you there's textures there. There's lifelike. It looks like a real tooth almost, except they're really white. Now that's what he wanted. He's a dentist, of course, so I've got to give him what he wants. But they're not too opaque and they're not too bulky. A really talented lab can go ahead and do this for you. And when you think about this, when you look at the bicuspid and you look at the cuspid and you think about no prep or minimal prep versus full prep, well, you think if I can do this with no prep, then why in the world would I want to do it with a full prep? And most of the time you do have the option. You've got to go ahead and really get training on this, because like any specialized technique, you've got to go ahead with training on this. But let me go through, some of the supporting things that make this worthwhile and make this really work for you. Many times with the veneers, you've got to build up the tooth underneath it. There may be an incisal edge missing. There may be a cervical area missing. You've got to go ahead and put composites in there. I don't know. Like most general dentists, I think in America, I've been using Kerr products for almost as long as I can remember. Something like Herculite's been around. I love to show this slide because, my God, we're talking about 13-year restorations on these teeth, and this is an area, one of the most common questions I get about veneers is, what do I do in the cervical region? If the patient's got an abfraction region, an abfraction area in the cervical region, and I've got to go ahead and put a veneer over it, should I restore it beforehand and then veneer it? The answer to me is yes. But you want to restore it with something that you know is going to last a long time and something that's really quality. How long's Herculite been around? And it's still one of the most outstanding composite resins that are out there. I use it routinely with many other composites. There are lots of new ones out there, and we can talk about all kinds of things in terms of shrinkage and micro leakage and that kind of thing. But who's been around for 13 years and longer? So it really testifies to what they do quite a bit. You talk about Optibond, their bonding agent. That's just phenomenal. It's been around. The chemistry has certainly improved over the years, but when you talk about standing the test of time, we like that in dentistry, don't we? The other issue that we have with no prep and minimal prep veneers is, how far up to the gingival margin do we go? And that's a common question that I get all the time. It's an excellent question. We don't go super gingival because if the patient's got a high lip line, then I've got a problem. We don't go subgingival because if the patient has, unless we have to go subgingival, but we try not to go subgingival because then I've got to deal with tissue and all the other things. Where we end up is what we call equigingival, and that goes right up to the gingival margin line. And a lot of times, though, I've still got fluid coming out of that equigingival area that I've got to control. This is an outstanding product by Kerr called Hemostasal, and a lot of you know Expisil. And certainly when you've got to blow open a pocket, Expisil is is a good choice. And again, there are many other materials out there. You can certainly use cord. You can certainly use all kinds of different materials out there. But for these little areas, and again, most of the time when it comes to no or minimal prep veneers, and I go equigingival right at the gingival margin, there are a few areas that are kind of oozing out. That's where I'll use Hemostasal. And I don't think enough dentists know this product. It's also by Cybron Kerr. It's an excellent little adjunct. I mean, it's a super adjunct for what we're trying to do here for that. But, again, this is a company, obviously, and I work with a lot of companies. Don't get me wrong. Most of you, have heard me speak many times. I talk a lot about a lot of companies. But I'll tell you this, I love the companies that have been in dentistry a long time with products that you can really trust. Here is a brand new product that, again, it's just slowly getting out to the dental community, and it's kind of taken the place of a lot of what I do with those abfraction lesions before I go ahead and put a veneer over it, and it's kind of taken the place as a liner under many of my composite resins there as well. And if I've got a little bleb, in a tooth, if I've got a little hole in the front of a tooth that I'm going to put a veneer over, I don't want to take an impression of that. So I'll use this product called Vertice Flow. This is the first ever flowable, self-etching, self-bonding composite resin. And boy, you're going to see a lot more of this. I mean, you're going to see a lot more of this coming out in the future from a number of companies, but you can leave it to Kerr to know that they've done this right. And we've been using this now for a few months. You couldn't rip it out of my hands because I use it every day that I practice a few times. I mean, it can be a liner, it can be a base, it can be an excellent build-up material, but for veneers and just smoothing out surfaces on teeth before I take an impression, no etching, no bonding. I can just put it right over, especially when it's dentin-based. Excellent, excellent product. And when you talk about adhesion, I mean, these microstutters, these SEMs that, from the R&D departments, I mean, this is phenomenal. I mean, this is the kind of adhesion we talk about with a bonding agent, but now we've got all this filler on top where you see the Vertice Flow that automatically bonds. That is phenomenal. Nothing short of phenomenal. So I use this product all the time. But in my veneers, any little blab, I want to smooth something out, any little liner or fraction lesions, and certainly, I mean, as a liner or base under my posterior composites, that is a great, great material to go ahead and do. Let's take a look at this because I'm going to throw one more product at you that you really need to know about. Here's a perfect patient for no or minimal prep veneers. And by the way, you can all go to my website, and I've got information on no and minimal prep veneers. Go to the download sections. We've got some ideas for you as to how to pick good cases and those kinds of things. Certainly, you can email me as well. I'm happy to help you out. You need training in these things, and I give some training courses around the U.S. on no and minimal prep veneers, so you're welcome to that as well. Just email me for more information. This patient's a great, great candidate for no and minimal prep veneers, and these are crystal veneers by Orem Ceramics. You could bleach these tetracycline stains all day. You know they're not going anywhere. And let me just show you. Here's the after. And I just wanted you to keep in mind, see, for this you need a cement that's going to be that can also be a dual cured cement. Because of all those spaces, sometimes that porcelain's going to hide some of that cement. Even with a strong light, you absolutely need a dual cure cement. I'll tell you, with many of my veneers, I will use a dual cured cement just because I want to make sure the whole thing is going to be cured very, very well here. NX3, Nexus 3, another outstanding product by Kerr, and here's what I love about it. And again, I use mostly dual cured cements because I love my lights, and I use a lot of different lights. They're all nice and strong these days, but just in case, it never hurts, especially in this kind of situation where you're going to have some thicker porcelains, and it's sometimes a little tougher for the light to reach. But here's what I like about NX3, the dual cure resin cements. Can you believe that there's still a problem here with some of the manufacturers where dual cure resin cements are still changing colors? I mean, it's hard to believe. NX3 does extremely well. I mean, you can see almost no color change. And for me, that's important. And that's extremely important when it comes to no prep veneers. And the reason that that's so important is because of this. You know, when you've got no or minimal prep veneers, like these crystal veneers, first of all, take a look at them. They're not too opaque. They're not too bulky. You see a lot of texture. You see polychromicity. You see a little bit of incisal translucence. These are all things that have really been missing by some of the other laboratories and some of the other folks that have been doing. And again, it's not laboratory only fault. It's a combination. Dentists picking the right cases and laboratories not being able to produce this kind of thing. I mean, this is unparalleled. We've not had this before before these crystal veneers by Orm Ceramics for that. I mean, these start to look like real veneers, and this is exactly, now I'm happy with what I put into the mouth, but here's exactly my point. If you, with crystal veneers or no or minimal prep veneers, when you've only got 0.3 millimeters of, in some of these areas, of veneers, then what will happen is the underlying resin cement color will make a big difference. Not so much if you have a 2 millimeter thick veneer, you know, a full prep veneer, but in a no or minimal prep veneer, you bet that's going to make quite a difference here. So if it's going to change color, turn a little yellow or orange, as you see on some of these other cements here, then that's going to be a problem. My thin veneers are going to have a little orange or yellow tint. Nobody likes that. But if you're using Nexus 3, and again, I've done my own studies with this and been using this for quite a while, then it's not going to change. And that's what I want. For thin veneers, you've got to be very careful of your choice of cements as you go ahead here. So the whole realm of this no and minimal prep veneers has really changed here quite a bit. Now, here's this fellow beforehand, and let's see the transition. It's not only women that make this transition, is it? It is men that make this transition all the time. You get him a decent shirt, he's got these nice new teeth, a little bit of Botox, lose the glasses, all of a sudden, we're talking about new people. Now we're going to start bringing you out of the realm of veneers and start going a little bit more in terms of total facial aesthetics. I mean, here you've got a patient here that has got these short teeth, but they have got a high lip line. So with this kind of a thing, I'm not going to go down. What I'm going to do is I'm going to go up. Now take a look. With this case here, I am not touching the teeth hardly at all. But we are going to use a laser to go ahead and do a crown lengthening procedure. And after some healing, that incisal length area is going to stay exactly the same. We're actually going to go up as opposed to going down. But here you've got some beautiful no and minimal prep veneers. And you can see they're lifelike, they're not too bulky, and they're, you know, the patient's normal. They're even a normal shade, for crying out loud. That's pretty groundbreaking in terms of where we've been for veneers. But I barely touched the teeth on that. They required almost no prep at all in doing this. And then when it comes to veneers and total facial aesthetics, now we're going to broaden it out there a little bit. What's really amazing is, man, there's almost no age limit. This woman's 82 years young. She's had a bridge on there from a cantilever lateral up in the upper right side, going back about 8-9 units, and she wants veneers. I told her to take off the bridge. She doesn't want to. The bridge is 40 years old. And if you've never done porcelain to porcelain bonding, again, go to my website, commonsensedentistry.com, and you will go ahead and you will see a step-by-step way to do these veneers. Do these veneers over the porcelain to porcelain bonding. You've got to learn how to do it. Many of you have gone ahead and have done it already, so you know what I'm talking about. It is very long lasting, and it is absolutely a great way to go ahead and do these veneers. I literally took an impression on this woman, and that's her afterwards. I mean, it's almost magic. And that's an 82-year-old. Geriatric cosmetic dentistry is the fastest growing part of cosmetic dentistry that's out there, primarily because geriatrics have three things they've never had before. What are they? They've got the teeth, they've got the time, and they've got the money if their kids haven't stolen it by the time they're 82. Just kidding for all the kids out there. But certainly it has really been astounding what we've been able to go ahead and do. And veneers should not look like veneers, certainly on younger patients. You're not going to be doing a whole lot of prepping. They should look really nice and normal. It's time for you to take a look at no prep veneers. Now, let's transition straight to total facial aesthetics. And let's take a look and see where we're going to go right now here. This is, look at the boom here in this is plastic surgery in the year, I'm sorry, I don't even think that the years are coming up, but 1997 to 2009. Look at this boom. It's almost gone up 6 times. And that's with some recession, because there was a big market crash and recession in the year 2000, right? And this still went up. You know, we wish dental cosmetics had gone up quite a bit as this. And I always use this as a proof when it comes to dental aesthetics here too. Take a look at this. Let's break down those 12.4 million procedures done in 2009 and see what kind of procedures they are. Well, only 15% were heavily cosmetic procedures. And biggest one being lipo, and you see all the way down. Well, if only 15% were heavily invasive procedures, then over 85% were non or minimally invasive procedures to look better done by plastic surgeons in the year 2009. The biggest one being Botox. The second one being dermal fillers. And I'm going to tell you what those are, because what I find is most dentists have no clue what these things are. So we're going to get into this quite a bit. Botox, by far, is the most common cosmetic procedure done in the world. We wish dental aesthetics was even close to this, and as much as we think that patients want dental aesthetics, well, guess what? They want Botox and dermal fillers a heck of a lot more. I mean, at 5.2 million procedures done of Botox in the year 2009. I mean, that far exceeds anything else that we are doing in dentistry. But should we be getting into this? Let's take a look. Well, yeah, it's finally coming. There's no question. It's finally coming to dentistry. And, you know, here's a podcast. You can go to the AGD website, Academy of General Dentistry, for a free podcast. You can certainly go to my website, commonsensedentistry.com. We've got tons, and we give our own classes in Botox and dermal fillers, which I'll show you a little bit later. But we've got free podcasts and downloads and all kinds of things to learn more about it, because in dentistry we don't know about it. Yeah, it's come to dentistry about now already. There is estimated that almost 10% of dentists are now providing Botox to their patients. Why is Botox so popular? Botox and dermal fillers, we'll lump them together both. Why are they so popular? Because it's everywhere. You've got, go ahead and look in any People magazine. See, I spend a lot of time talking about practice management when I teach. I probably spend half the time on practice management and half the time on clinical issues. And I teach a lot of clinical issues. But I love the practice management stuff, but I don't read the dental journals to get my practice management information. You know why? Because my patients don't read them. I read People magazine. I read the consumer magazines that people want to read, and they want to look like these stars. And, I mean, just here, you know, take a look at this next one. These are straight out of People magazine. How much did it cost for Demi Moore to stay young forever? Grand total is $470,000. The bulk of it, if you take a look at her neck and above, where I hope you are looking, the bulk of it is spent where? In her face. In her face. Botox being $84,000 of that. Teeth whitening, it says here, $36,000. What the heck is that? Well, I would assume that's Beverly Hill veneers, but that's pretty funny. Lip plumping injections is dermal fillers. I mean, that alone accounts for almost $150,000 of this entire total. Going forward, people want to look young, and that's why it's so popular. You can't read almost any aesthetic consumer magazine without people seeing Botox a million times over. I'm going to take you through the quickest facial aging lecture you've ever been on. This is my 6th grandchild, 6 out of 7. I'm blessed with 7 now. And she's cute. She's pretty. She's got all this facial fat in there. She doesn't have a wrinkle or barely a fold on her face there at all. But this is not the face that most people want. This is the face that most people want to remember, don't they? I mean, this is the face that is late teens, early 20s, not a wrinkle, barely a fold. But look at those lips. I mean, these are nice, full lips. They're not ridiculous duck lips, but they're nice, full lips. So let me ask you a question. You're a dentist. Why in the world won't you go ahead and treat lips? And what I'm talking about here now with facial aesthetics is simply soft tissue aesthetics. I'm not talking about gingiva now. I'm talking about right outside the mouth. Excuse me, right outside the mouth, and certainly you can go to the entire face, soft tissue aesthetics, to go ahead and complement your hard tissue or teeth aesthetics that we're doing right now. But remember that face. And let's go ahead. Here's the next face I'm going to show you. That's a 50-year-old. She happens to be a hygienist. Nothing, this is not a result of being a hygienist, but you lose collagen and fat in the face. You can almost imagine that her face is dropping, and you can almost see it dropping when you look at this face here. You all see this in the mouth, by the way. You've got a patient you've known for 20 years. They used to show their top teeth. Now they show their bottom teeth. And then you turn into, I'd say, about a 65-year-old politician, and you look like that. Now, that is probably one of the worst pictures ever that you're going to find of Hillary Clinton. And obviously, she does get some help cosmetically on her face there as well. And by the way, I got this. I Googled. I needed a picture of a wrinkled woman. I Googled wrinkled woman. This was the first hit that came up. So I don't know why, but it's not at all a political statement. But forget who it is. Let's talk about what's happened. Look at her forehead. Wrinkles around the eyes. Wrinkles between the eyes. Wrinkles. Take a look around the mouth. Look at now these deep nasolabial folds. And, thin lips around the mouth. Marionette lines going from corners of the mouth down to the chin. Starting to show a lot of lower teeth. Aren't we here? Yes, that's what happens. The face loses collagen and fat. The skin gets wrinkled. And all of a sudden, now you've got a face that is starting to drop and look very wrinkled. That's not what people want to go ahead and look like. Now, for some of these wrinkles that are caused by muscle motion, listen carefully. Botox is only for the wrinkles caused by muscle motion. In her case, that will be around the forehead, around the eyes and between the eyes, and the wrinkles around the lips. These deep folds, that is dermal fillers. Dermal filler is basically a plumper, and that's going to plump up those folds. But I'm going to show you a little clip here, and that's going to really help you. When we talk about refilling, that's what we're talking about dermal fillers. It's a plumper. When we talk about relaxing the skin, we're not really relaxing the skin, we're relaxing the muscle underneath the skin that's causing the wrinkles. That's going to be Botox. It is a neurotoxin, and it will paralyze temporarily the muscle underneath the skin. Resurfacing is dermatology. I don't do that in my office. And redrape and contour is going to go ahead and be plastic surgery. That's for sagging skin. None of what we talk about in Botox and dermal fillers is for sagging skin. It is only for wrinkles or folds in the face here. And here's just a typical, Botox cosmetic ad. I mean, for crying out loud, there's not a wrinkle on the patient's face. And you see these kinds of ads all the time here. So let's take a look at a couple of patients here there as well. And here you've got wrinkles in the forehead. She actually is also a facial pain patient. Botox is a toxin that will relax the muscle, paralyze the muscle for a 3-month period of time. Botox wears off in 3 months. Well, when you think about that, and you think about a patient that's got facial pain and migraines, not only is Botox is great for a cosmetic result, and I'll show you her cosmetic result. I'm actually going to show you her treatment. All of a sudden, if you can relax or reduce the intensity of contraction of a muscle that is causing facial pain, TMJ and all kinds of other things, then boy, you really have got a great therapeutic treatment in dentistry. And by the way, Botox as a therapeutic treatment in dentistry is allowed in every state under your Dental Practice Act, because you're allowed to practice dentistry and you're allowed to treat TMJ and bruxism. So that's number one. Number two, it's taught in a number of dental schools for therapeutic reasons. Botox has been around in dentistry for a long time. But now many states are allowing, over 30 states now allow dentists to perform Botox for now also cosmetic procedures. So, know the difference. Therapeutically for dentistry, sure, you can use it in every state. That's called dentistry. But now for cosmetic reasons, that's quite a bit. When you couple the two, you've got a big winner in the dental office there as well. And I'm going to show you her treatment in just a second. Lines around the eyes, this is my patient. All of a sudden that line is gone. What happens? I'll just flip back for a second. This line is caused by the muscle in motion, the orbicularis oculi, but every time it squeezes together or she smiles or squints, all of a sudden you relax only that little part of the muscle, that's gone. Very good cosmetic effect. The women, by the way, that are on this webcast, they get it, man. They get it immediately. Sometimes the men need a little bit of pushing here. So it's really, really important here. And what you see here is a patient of mine, and this is about a 5-minute clip that is going to deliver a Botox treatment and a dermal filler treatment. And so let me tell you what's going on here. She's also a facial pain patient. Watch her masseter, watch her left masseter pop in and out as you go through this entire thing here. And you'll be quite amazed as to what's going on. Watch this masseter really pop in and out. And what you're going to see is she's a facial pain patient. I'm going to show you her dentistry here in a minute too. And what I'm giving her now is Botox. This is a typical Botox treatment. Any dentist can learn how to do this, for crying out loud. You give injections all the time. This is just an extra oral injection. You've got to know the anatomy, physiology, pharmacology. You need training. I mean, like anything else that you do. Sure, Botox is a neurotoxin. Guess what? Your local anesthetic is much more toxic. And you've got to know where the muscles are. You've got to know how much Botox to put in there to deliver the desired result. I mean, right now we're talking about the cosmetic part of this as we're doing this. But it's also going to take care of some of her facial pain. So some of her facial pain is going to go ahead and be taken care of here as well, because we are going to relax these muscles, as you see here. What we're going to do. Now we're going to go to around the eyes there as well. And again, dentists, by the way, are the best injectors. We train all healthcare professionals, physicians, nurses, just about everybody else. Dentists are by far the best injectors. You give more injections as a dentist than any other healthcare professional, bar none. I don't know if you know that. You give more on a daily basis than just about anybody else, literally bar none there. So that's where we're at there. That's for the around the eyes. But now I'm going to give her some in the masseter region here too. And you're going to see what I'm not going to, I don't want to go ahead and take her masseter out. If I go ahead and paralyze that masseter muscle, you would need a lot of Botox to do it. She'll walk around with her jaw hanging open. I don't want to do that. But what I do want to do is go ahead and reduce the intensity of contraction of her masseter muscle. And that's why I'm giving her just enough Botox. That's why you need training. You need to know how much to give here. So it's just enough Botox to go ahead and take that masseter down a notch so it doesn't contract as hard. And that's going to make a major difference to her. She's had chiropractic. She's gone to just about every other healthcare professional for her facial pain. And we've equilibrated her. I'm going to show you her dentistry in just a minute. The Botox really helps. It gets them out of pain. Now, all that Botox was done without any anesthetic there as well. Sometimes, as you see, we'll put an ice pack on her as she's doing right now. But now I'm going to give her some dermal fillers. Take a look at the creases underneath her nose and some of her nasolabial folds. I'm actually going to go ahead and put a dermal filler that is called Juvederm. And Restylane and Juvederm are the two most common dermal fillers. And it's a plumper. And for this, we did get her numb a little bit. So she's been numb before we started this clip, and usually I get them numb first, deliver the Botox, and actually go ahead and give this dermal filler. And it's just a little bit of filler, and you won't see this dramatically because it's not a close-up shot on where I'm giving it now. But take a look before and after, before I start injecting on the other nasolabial fold when we move her over. Then take a look after. You'll see how it fills up. I mean, this entire clip is only about, is only going to be 5 minutes when it's finally done. I mean, this is a 5-minute treatment. That includes Botox and it includes the fillers. Oh yeah, I got her numb. Throw in another 5 minutes. I don't have to get her as numb as I normally would for dentistry. Look how deep that crease is, and then you'll see right after it will pretty much completely disappear after I give her this dermal filler. Dermal filler is just a synthetic hyaluronic acid that is taking the place of her collagen and fat. It lasts for about 6 months. Both of these are temporary treatments. Very important. Botox lasts for about 3 months. This lasts for about 6 months. And then they have to be administered again. So they come back to you. And that's part of the entire scenario. There are big advantages to them being temporary treatments, that's for sure. Now take a look at this. That nasolabial fold is pretty much gone. And she's got a nicer, young-looking result here. And now I'm going to show you some of her dentistry as we go through this here, too. Now think about this. And that's pretty much it for this clip. Think about this. 5-minute clip, 5 minutes worth of treatment time, another 5 minutes to get her numb. And You know, folks, for most offices around the United States, not just dental offices, we're talking about the aesthetic offices, that is about well, I'd say about a $2,000 treatment that we just administered on her, anywhere from $1,500 to $2,500, depending on where you are, in a 5 to 10, even 15-minute time span. The cost of the Botox is your biggest expense. The cost of the Botox and the filler, that's pretty much unparalleled to what we are to where we are here. Now let's bring this whole program together to you with a couple of cases. And here you go. This is her beforehand. I did not see this patient. This is that patient you just saw getting injected. I did not see that patient at this point. This we got from her previous dentist. She comes in with 2 all-ceramic crowns on tooth 8 and 9, the front, the central incisors there, the right and left central incisors. And she also came in to a previous dentist, and she wanted no prep veneers. She came in waving an ad. She wants the no prep veneers. Here's exactly what we're talking about. This is where I see her. And take a look at those veneers. It talks exactly to the point I made before of too bulky and too opaque, especially the canines. Now, she likes these veneers. She doesn't love these veneers. So take a look. Too bulky on the canines for sure, even some of the other teeth, but they look dead. They're not lifelike. They don't have the texture. They don't have the quality. So she likes them, but she doesn't love them. She'd like to know if she can get them redone. We quote her a fee. Obviously, that fee gets a little expensive, so she'll think about it. But now, here she comes. This is that patient that's a huge brexer and clencher. You see her big masseters. You can even see them and the squareness of her jaw. That's not skeletal. Some of that is just out and out, the masseter hypertrophy there. Now, this is her. And she comes to me about 8, 9 months later. She doesn't have a choice. I'll show you the close-up. She's got to have them redone. Why is that? Because, man, it's a mess. This whole case is falling apart. This is everybody's fault, by the way. This is laboratory. This is dentist. This is not equilibrated. This is occlusion. In the lab, they didn't do a good job evaluating the occlusion. The dentist ultimately did not do a good job equilibrating the occlusion, and no one controlled her bruxing and clenching. I mean, you see on the upper right first premolar, the whole incisal third is gone, and the upper right lateral incisor, that popped off completely at this point. That's just a composite job that someone patched up. There's this weird cervical fracture on this other one. I mean, this case just falling apart. I mean, just falling apart. So now we have to rip everything off there, and you can see still a lot of enamel. The 2 centrals didn't have a choice. That's the way they came in to that previous dentist. These are her crystal veneers and the 2 central ceramic crowns. Look at the texture. She wanted them white. She got white. Okay, that I don't control when patients want them white. But a little bit of incisal translucence. You see all that reflection. That's texture. Look at the cuspids. I mean, they look like real cuspids in terms of their shape. They're not too bulky. You know, whenever you look at them too close up, they never look too good. But take a look really close up. I mean, the tissue sure loves these things. It didn't love those previous veneers and crowns very much there as well. And that's her. I have now treated her from chin to forehead. And I have done all that on her. And now, total facial aesthetics, you as the dentist, again, in most of your states, you're able to do it. And certainly, what's incredible about this is that you as a dentist are the only ones that can deliver total facial aesthetics, because you're the only ones that can do teeth. No one else can go ahead and do the teeth here. So what we can accomplish now is amazing with patients here. Let me just show one more case at you, and this is just an ad for Juvederm. This is one of the dermal fillers. Juvederm and Restylane are the 2 most popular dermal fillers. You'll learn about that in training too. Take a look at this case here. She comes in, and this is a dentist too, by the way. She's about a 43-year-old dentist, and take a look at her case. She's got uneven lips. She's got deep nasolabial folds. I'm just going to show you her soft tissue aesthetics here. We go from here, that's the before, that's the after. Much more youthful appearance. Lips, not big, fish or duck lips. We're talking about subtle lip augmentations. Why should a patient leave your office with beautiful veneers and wrinkles around their lips? I told you that line before was a real lie. See, we're not giving patients great looking smiles when we're doing 10 veneers. right? We're still only giving them great looking teeth. If you really want to give them great looking smiles, then the only way to do it is to do all the tissue around the mouth, the perioral areas, and ultimately the entire face. Now you're giving them a great looking smile. But here, I show this case a lot to dental boards and those kinds of things when it comes to it, because people tell me all the time, well, this isn't dentistry. Well, let me show you. Here's that patient's full face beforehand. We'll get rid of the wrinkles around her eyes and around her forehead and between the eyes, and that's all fine and dandy. But what's her dental aesthetic problem? She has got a high lip line. But not only does she have a high lip line, gummy smile, she shows too much gummies. She's got more gummy smile on her left and less gummy smile on her right, but still a gummy smile. She doesn't like that gummy smile. There are lots of ways to go ahead and take care of that gummy smile, right? From a dental aspect, what can we do? We can do a bunch of things. Can we go ahead and do orthodontics? We can go ahead, if you're an oral surgeon, you can go ahead and do a class 1 Lafort maxillary fracture. I mean, who the heck is going to do that, for crying out loud? We can go ahead and do crown lengthening. I've done many cases like that, so have many of you. Crown lengthening, veneers, crowns, all across her upper arch to make a look. Or, once you learn and train on Botox and dermal fillers, we can give her some Botox to relax the upper lip elevator muscles so that they'll come down a little bit. We'll give her some dermal fillers that will go around the lips and fill out the lips a little bit and hide some of that gummy smile. We can give her some dermal fillers in those nasolabial folds, which will really hide some of that gummy smile. And now, from a totally minimally invasive approach, I have not touched her teeth. She goes, and I don't care which way you do it, by the way. I don't care if you do it with ortho or you do it with crown lengthening. I can do all those. I give all these options to the patient. Let them decide to go ahead and do it. She's a dentist. Actually, she's an excellent dentist that does a lot of a lot of the dentistry I talked about with crown lengthenings and veneers, but she didn't pick that choice. She went ahead and picked just Botox and dermal fillers by themselves, fill out her lips, fill out her folds, relax the muscles for the upper lip. Don't do this as your first case. You need training to go ahead and do this. Wow, all of a sudden, that's a great result for her. By the way, over the long term, this one's probably more expensive because she's got to go ahead and have it repeated every so often to keep this result. But she didn't want to get ground down at all. She didn't want to go ahead and have all that gum tissue removed, that kind of thing. It's not my choice. It's the patient's choice to go ahead and do that. And then to really build your portfolio, you take the absolute worst picture of a patient beforehand, out of bed, no makeup. I do the Botox and dermal fillers. That's her afterwards. You can make these people look like different people. It's really incredible what we can do. And go to my website if you're interested in this. We train people from around the world, literally. I mean, we give about, under the American Academy of Facial Aesthetics, I'm the president of the American Academy of Facial Aesthetics. We give 2-day Botox and dermal filler live patient hands-on workshops. You go ahead and you're going to actually work on these people yourselves. And that's how you're going to learn. That's the best way to learn. But we actually put out the first DVD ever by dentists for dentists that will take you through actually that case I just showed you and show you how we achieve that comprehensive result with Botox and dermal fillers. Total facial aesthetics. It will really open your eyes from now on. So, thanks. It's been great to be with you. You can email me any questions. I'm sorry we kind of ran out of time here, but we had a full docket here tonight. By all means, email me. I'm happy. I usually respond to about 50 emails a day from dentists from around the world and hygienists and just about anywhere else. CommonSenseDentistry.com. It'll give you a lot of good resources. I'd like to thank again Kerr for sponsoring this course. They do a great job with these webcasts. Everybody have a great night. Thanks for being here, and let me know if I can help you again.